Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Good afternoon once again, Dave Watts with you. And last year we introduced you to an amazingly comfortable way to get to the dentist for that needed work. Now this hour, we're back into the dentist's chair with more on a process that you're probably going to look forward to. We're going to be talking about the process of sedation dentistry, how it works, why it's preferred, and we'll look into the area of dental anxiety as well. We have two guests to share expertise this hour. A little later on, we're going to welcome psychologist Dr. Irina Ivanova. But right now, though, very pleased to welcome back the owner of Sedation Dental Group, Dr. Dania Alkhani. Good afternoon once again, Dr. Alkhani.
Thanks for having me, Dave.
Great to chat with you once again and get caught up. And coming up, we're going to get into the latest approaches to dentistry, as we mentioned, and we'll review all of the services of Sedation Dental Group. And as we mentioned before, of course, we'll be welcoming Dr. Ivanova, and we'll talk about some of those issues relating to anxiety with those dental visits a little later in the hour. So then, to begin, for those joining our conversation for the first time, and certainly a reminder for those who heard our previous show a few months back, let's talk about Sedation Dental Group. Let's have a quick overview.
Thanks, Dave. So Sedation Dental Group is a dental clinic that specializes in providing dental work for all levels of sedation and all modalities. We find that a lot of fear comes from past experiences, whether it's dental related or not. Many of our patients have had traumatic experiences when they were younger at the dental office, and this resulted in delaying seeing the dentist or avoiding coming to the dentist altogether. We have patients that, for example, have served in the military and have come back with PTSD, and this resulted in them having reactions to certain dental noises. Some people just don't breathe well and are extremely afraid of the anticipation of pain. And some people have some extreme gag reflex and cannot tolerate longer dental procedures. So these are just some of the issues contributing to the dental anxiety or intolerance that we see with our patients when it comes to doing certain dental procedures. As an overview, our office has gone to great lengths to train both the clinicians and our team in how to deal with anxious patients. We have laid out a lot of methodologies from the time the patient calls the office and how the receptionist responds to the calls, to their first consult with the dentist, to their pre-assessment with the anesthesiologist if deeper anesthesia is needed, to the day of the actual treatment. They will be handheld every step of the way by our team members. We've had sessions with psychologists ourselves as a team to explain to us the mindset of patients who struggle with overall anxiety and not just dental anxiety. So Sedation Dental Group essentially is a one-stop shop for everything. We've teamed up with clinical psychologist Dr. Irina Ivanova and her team to create a tailored approach for patients who suffer from dental anxiety, whether the anxiety is associated with even entering the dental clinic or anxiety from the actual treatment. So overall, Sedation Dental Group is your one-stop shop for everything dental related, including cleanings, whether you have dental anxiety or not.
All right, we're going to get into some of those specifics shortly, but Dr. Alkhani, you touched on so many great benefits here. Let's take a look at even more that really sets Sedation Dental Group apart from other dental clinics.
Absolutely, Dave. So we have a full-time medical specialist team in anesthesia, and these specialists have gone to school for over 10 years to learn how to safely put people to sleep. We have thorough safety and procedural protocols so that we can do hospital-grade anesthesia in our out-of-hospital settings. We cater to a large portion of the population, including those with complex medical histories. A lot of these patients are referred to the hospital, and the wait list is years for them to see the hospital. So we've essentially become that one last stop before going to the hospital. We almost do it all as well when it comes to dentistry, whether it's a cleaning that's needed or filling or surgical extractions, full mouth reconstructions. We can do it all, whether sedation is needed or not. So we've essentially, like I said, have become the one-stop shop for all your dental needs.
All right. Now, the Sedation Dental Group Ottawa, it's been around for some time in the Ottawa area. Maybe you can give us a little bit of a history of the practice and how it has evolved under your leadership.
Sure. So Sedation Dental Group is over 40 years old. It was first created by a dental anesthesiologist, Dr. Elwood Mitchell, and it was actually at a location that was just a few blocks down the street from where it currently is. So a few years later, he moved that location to his current location in downtown Ottawa, and then sold it to 3 dental anesthesiologists. I then bought it all about 6 years ago. The original model of this practice for a long time was that you had one provider that provided both the anesthesia and did the dentistry. When I came on board, not being a dental anesthesiologist myself, I took a fresh look at things and noticed there was too much liability and stress on one clinician and switched the model to in such a way that there's a medical anesthesiologist that provides the sedation and dentist that's actually doing the dental and surgical work. Many of our patients have been here for the entire 40 years, so we have been able to maintain that continuity of success throughout the years.
Dr. Alkhani, you touched on some advanced sedation options, but there are more, and this is certainly key. What are they, and what are the benefits?
So I'm just going to kind of give you a brief overview of everything that we provide and then dive into the deeper sedation options. So we have all levels of sedation, whether it's mild sedation with laughing gas or an anxiolytic pill where the patient on average is going to be more conscious and awake. We have moderate sedation, and then we have deeper advanced anesthesia care that basically can put the patient to sleep. So when a patient comes in, we see what it is about the dental experience that bothers them or causes them anxiety. Then we tailor the sedation to their needs. Advanced sedation technique is quite unique and is only done by our specialists, and we are one of the most highly qualified offices in the city that provides this. A thorough medical history is taken, and the patient usually are then required to do a pre-assessment with our medical anesthesiologist. Once they are deemed fit for care, patients are put to sleep where they are not aware of what's happening during the procedure and they do not recall the dental procedure. Depending on their health and their health history, we can do either deeper anesthesia care or general anesthesia. We then do a thorough follow-up assessment the next day to make sure the patient is in good care.
Well, Dr. Alkhani, it's easy to see why Sedation Dental Group is a preferred option for any and all dental work. And the website for your information and reference, sedationdentalgroup.ca. Now, coming up right after the break, we're going to bring psychologist Irina Ivanova into the conversation, and we'll get into some of the issues and remedies for dental-related anxiety. Experts on call on News Talk 580 CFRA. We'll be right back.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Welcome back. A very interesting conversation with our friends from Sedation Dental Group. We welcomed them to the program last year, and it's always great to have Dr. Alkhani back with us. And this time around, being that the Sedation Dental Group provides a unique service for those that are maybe a little anxious about going to the dentist. And I'm going to tell you that pretty well takes care of just about all of us at one time or another. I'm going to welcome this time around Dr. Irina Ivanova. And Dr. Ivanova is a psychologist. Welcome to Experts on Call, Dr. Ivanova. And let's talk a little bit about your expertise in psychology and anxiety management. That's got to be a pretty tall order.
Thank you, Dave. I look forward to it. So I'm a clinical psychologist. I have founded my clinic in 2015 after I completed my postdoctoral fellowship at the University of Ottawa and the Ottawa Hospital. And I founded Ivanova Psychology and Associates to help people with anxiety, trauma, depression, relationship issues, and specifically working recently in collaboration with a sedation clinic on dental and anxiety. We also help clients with neurodevelopmental difficulties and sensory processing difficulties. So it fits nicely with what we're going to talk about in assisting those folks with with difficulties with sensory problems.
Now, what are some of the more common psychological reasons behind dental fear and anxiety?
Believe it or not, 1 in 5 people experience dental anxiety. And most of the time it's, as Dr. Alkhani mentioned, has to do with a past negative experience. So one bad experience in a dental chair can create a lasting fear association. People are often afraid of pain, anticipating that they're going to be uncomfortable, and it often leads to that avoidance cycle. They're afraid of losing control, so lying back in the chair with all the lights and sounds can be really anxiety-provoking and make the clients feel really trapped. The clients are often ashamed or embarrassed. They're worried that their teeth are in bad shape, so they don't go to the dentist, and that leads to that vicious cycle of avoidance and shame and worsening dental conditions. And like I mentioned, sensory sensitivity. So individuals who are sensitive to lights, smells, sounds, touch, dental procedures can feel really overwhelming. So individuals with, for example, autism spectrum disorders or ADHD or trauma histories, it can be really aversive for them. And folks with general anxiety and phobias will be more susceptible to this type of anxiety. And at times it can be witnessing their parents have an anxiety or fear, or other portrayals of negative experiences in the media can create that association in the brain that dental care is dangerous. And like I mentioned, trauma histories can unintentionally dental settings can unintentionally retrigger memories of medical or personal trauma.
All right. Now let's take a look at some of the science behind dental anxiety overall. I guess some people associate dental visits with pain, loss of control, or bad past experiences. Can you explain why our brain reacts this way?
Sure thing. Yeah. For a lot of people, dental anxiety is more than just nerves. It's a real stress response rooted in how our brain works. So if someone had a painful or scary dental experience in the past, the brain stores that memory in the fear system. So even just thinking about the dentist, hearing the sound of the drill, or sitting in the waiting room can trigger that same fear all over again. Part of this is because our brain likes to feel in control. At the dentist, when your mouth is open and you can't talk, it can feel really unpredictable, and that can lead to an anxiety. And so even if nothing painful happens, just feeling helpless is enough for that pain, for the brain to go on the high alert. And here's the tricky part. The more we avoid going to the dentist because of the fear, the more the brain believes it's something dangerous. So the fear gets stronger over time.
So it's the old story, face your fears and deal with it. And in this case, there is an option to make you feel a little bit better. A big option.
That's right.
Absolutely.
That's right. So that's the good news, is that the brain can rewire itself with the right help, like going through a psychological treatment like cognitive behavior therapy or reconciliation therapy that we offer at our clinic. Those fear connections in the brain can weaken. So people can really overcome the dental anxiety, even if it's been there for years.
Now, I guess I know you kind of touched on this, but are there personality traits or past traumas that make someone more likely to have a strong fear of the dentist and getting into the dentist's chair?
Absolutely. Past traumas, for example, individuals going through a sexual assault experience, that can be triggered in the chair. So a sense of helplessness, or even, being in the dental chair, the unpredictable sensory experiences all can lead to that re-traumatization in the dental chair, if not approached with care and sensitivity.
Let's take a look at recognizing some of the anxiety that patients might experience. For example, how do people experience dental anxiety, and what are some of the physical and emotional signs of this?
Yeah, so emotionally, patients might feel a real sense of dread or panic, even just thinking about dental appointment. They can become irritable, so they may come across as more agitated in the appointment, which can often put off the staff when we don't understand that underlying that irritability and anger is actually a real fear that's driving it. Some clients can be tearful or feel that sense of helplessness, like they've lost control. So there's often that fear of pain or embarrassment about their teeth, and some will go to great lengths to avoid the dentist. And on a physical level, dental anxiety shows up in a lot of different ways. So people might experience a racing heart or sweating, shortness of breath, or nausea or upset stomach. Some people tremble or clench their fists without realizing, and that can often lead to that the anxiety loop. The more tense they are, the more anxiety their brain perceives, and that creates a loop of an anxiety that makes them maybe even more experience the pain in a more intense way, or the fear in a more intense way.
You know, you touched on something a few minutes ago, Dr. Ivanova, that I find really interesting. Avoiding the dentist really adds to the fear cycle and really the worsening of overall oral health. Let's talk about that.
Yeah, well, if you think about avoidance, is it provides a nice relief in the moment. So if you don't deal with it, you're not feeling that anxiety. So there is this false sense of safety that gets created. So the unfortunate part is the brain never gets to learn anything new, right? That it's maybe uncomfortable, but it's not dangerous. And that's what I work with my clients with, is that, using statements like, it's uncomfortable, but it's not dangerous.
Dr. Ivanova, we're going to get back to you shortly, perhaps just after the break, but I want to bring Dr. Alkhani back into the conversation again. And your perspective, essentially, Dr. Alkhani, on as a dentist, and certainly you see anxious patients every day. How do you recognize when someone is feeling overwhelmed?
Honestly, Dave, it starts with our first initial consultation appointment. When we meet our patients, we look at everything from body language to past history to triggers. After the patient is seated with our treatment coordinator in a more relaxed setting where many patients feel more comfortable, they are more likely to feel more relaxed and more open with them. It is definitely a no judgment zone in this office. We tell them this anxiety has robbed them of enough of them, and this stops here, hopefully. Finally, when they meet with our anesthesiologist, they have the chance to disclose what is distressing them if they choose to. Every step of the way, we welcome not only the patient, but even their loved ones or caregivers to be present, as it is truly a holistic experience, and we welcome the feedback of trusted family and friends if the patient wishes to include them in the process.
So I'm curious, how did your team go about making treatments as stress-free as possible for these patients?
We listen to our patients. Really, that's key. We see what accommodations they need and suggest some resources we have that they may not be aware of, such as psychological services with Dr. Ivanova. We ask patients to not hesitate to call whenever they have questions, and we can either try to answer over the phone or they can come in for multiple consult appointments with our treatment coordinators free of charge. We move at a pace that the patient is comfortable with and try to address their needs every step of the way.
We're going to take a quick break on Experts on Call on News Talk 580 CFRA with our guests, Dr. Dania Alkhani, and she's the owner and dentist with Sedation Dental Group. And she's joined this afternoon by psychologist Dr. Irina Ivanova, and we're looking into the sedation process and helping to manage the fear and anxiety that often surfaces with a trip to the dentist. So the website to check out as well, sedationdentalgroup.ca. We'll be back in a moment.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
If you're just joining us, good afternoon. Our conversation this hour continues with Dr. Dania Alkhani. She's the owner and dentist with Sedation Dental Group. And also with us this time around is Dr. Irina Ivanova, and she's a psychologist collaborating with Sedation Dental Group. Great folks to know and to feel better about getting into the dentist's chair, that's for sure. Now, just in case you're keeping track of these things, always important, the website, sedationdentalgroup.ca. I want to go back to our conversation with Dr. Ivanova this time around. We're talking about the psychological techniques for managing anxiety. And I have to ask you, Doctor, what are some of the strategies that patients can use to reduce anxiety before and during a dental visit?
I would say to start off, booking an appointment first thing in the morning so that you don't have that whole day of building up an anxiety throughout the day and getting more wound up as the day goes on. Asking the clinic when is a quieter time at the clinic, especially if you're having sensory issues, sensory processing issues, and choosing a time that's the quietest and calmest in the clinic. And I think the key thing that Dr. Alkhani has been talking about, they really listen to their patients. So ask the dentist, tell them ahead of time that you're anxious. Ask them what kind of accommodations are available. Would they be able to offer longer appointments if that's needed for calming and reassurance and breathing techniques? Asking for breaks, maybe gentler techniques. Other things that they could try is breathing techniques. It's sort of people roll their eyes when they hear of deep breathing, but it's actually the most effective, the most the most available tool that we have to let our brains know that there's no threat. So taking a breath for 4, holding for 7, and exhaling for 8. So we call it the 4-7-8 breath, can be really soothing for the nervous system. And just sort of a gentle reminder that you're okay. There's no danger here. I use this technique often when I need to reset my nervous system. Sometimes I use it while I walk, so it kind of it's easier to count because the counting can be a little bit tricky. Some people really like progressive muscle relaxation, so tensing, your muscles and relaxing gradually, starting from your feet, moving your way up to your torso. And what I've done with some of my clients with success is visualizing, themselves in the chair, going to the dentist, feeling calm, feeling safe and in control, knowing that they can do this, knowing that they can ask for a pause or a break if they need. Some people really benefit from bringing a comfort item. So a fidget toy or even a weighted blanket, can be helpful for that. Asking for a friend or a family member to come with them or be with them. Wearing headphones. And as I mentioned, maybe I didn't mention this, but listening to music, bilateral music can be particularly helpful for the nervous system. And bilateral music, the music goes from one ear to another in sort of a rhythmic way, and our brain tends to respond in a really calming way for the nervous system. And you can just find that on YouTube. It's readily available.
Dr. Ivanova, I'm really curious. What is cognitive behavioral therapy? Let's talk about that.
Cognitive behavioral therapy is probably one of the most well-researched treatments out there, and is considered one of the most effective treatments for dental and anxiety. And cognitive behavioral therapy focuses on cognitive distortions that people develop. So maybe things like catastrophizing, thinking the worst case scenario is going to happen to them in the dental chair. And it looks at the behavioral avoidance. So when people are stuck in that avoidance cycle, through the cognitive behavioral therapy, we try to help them break that cycle by gradually and slowly increasing their confidence and facing those fears. And it is effective for approximately 70 to 90% of the patients. Another unique thing that we do in our clinic is called reconciliation therapy. And that is also highly effective treatment, very short term, only requires 6 sessions. And it with the aid of propranolol. So it's a blood pressure medication, very safe medication for most people if they don't have complicated health histories like asthma or diabetes, for example. And if a family doctor can examine you and prescribe this medication, we would typically work with a fear memory that a client has developed around dental procedures with the use of propranolol. So propranolol kind of works to help to take out the emotional fear out of the memory and help people have less charge, less distress around the dental procedures.
How can parents help their children develop a positive relationship with dentistry early on? I suspect that could be a challenge at times.
It can be, especially if the parents are anxious themselves, right? So kids pick up on our mood, on the parent's mood. If you're anxious as a parent, the child's going to be anxious. So I recently took my 3-year-old to a dentist for a cleaning and a checkup, and I really worked at trying to be calm and at ease, and using statements like, "You're doing a great job," and "Let's have a look. Let's let the dentist have a look and count your teeth," and just getting them engaged and being curious about the environment and different tools around them. And the dental hygienist commented on how well I was doing with my child, because he responded really well to the procedure and practically got through the whole experience, which was rewarding.
Absolutely. I want to bring Dr. Alkhani back into the conversation once again and look at the role of sedation in overcoming anxiety. I guess that role does play a big part in helping patients with severe anxiety. Let's look at that.
Yeah, absolutely, Dave. Sedation dentistry helps both the dentist and the patient get through the dental treatment in the most comfortable way for the patient. So although we do specialize in giving sedation, sometimes a patient may just need a little bit of coaching to get through the procedure, just like Dr. Ivanova had mentioned. And we would ask to what it is that they need and kind of help them slowly through the process. So some patients don't actually require sedation, but they require kind of a team that's been trained in coaching them to get through the process. However, that may not be enough for many people, and there's no shame in that. And many of our patients choose to have some level of sedation. Some may need very mild sedation to help them get through, for example, something that might be as routine as a cleaning appointment, while some are extremely needle phobic, for example, and may need general anesthesia. So depending on your case, we can cater it to what you need, but sedation goes a long way in helping patients even before entering the office, knowing that that is an option to overcoming some of their fears.
I guess conversation has a lot to do with it as well. Talking to the patient, just in perhaps a softer tone and saying some reassuring words, that would certainly contribute, I would imagine, to a more comfortable position for the patient.
Absolutely. So, like I said, sometimes patients just need more coaching, and we walk them through it. So we just had a patient literally last week who came in, wanted to try the procedure with no sedation, but sat there very tensely, clenched to the chair, couldn't relax. And we just calmly walked her through. We let her know that this is very safe, that she can stop us at any time. And we just told her, to just unclench as much as she can and just to kind of relax and let go in the chair as much as she possibly can. And that's all she really needed. So just a very slowing down of the procedure and just a very calming voice.
Dr. Ivanova, your thoughts on that?
I think that's a really important point that Dr. Alkhani is making, is slowing things down. When people experience trauma, it's like in turbo speed. Their brain doesn't process the information, so everything feels really overwhelming. So to help the nervous system deal with these symptoms, slowing down like voice and procedures and making the environment as soothing as possible is really, really key.
I guess so. Now, I want to kind of get back to Dr. Alkhani for just a second here. And I'm curious about sedation therapy itself. I know that's for complex procedures. We've talked about that. But can it be used for routine dental care as well?
Yeah, so sedation is used to help supplement and ease dental treatment. So we do it in all areas of dentistry. So like I said, sometimes just a routine exam or cleaning, sometimes it's just to take x-rays. Those are very fundamental parts of dentistry and they're very routine, but some patients just cannot handle it, whether it's because they're very nervous of having something in their mouth or they're extreme gaggers. So we can do them for routine dental care, but we can also do them for things like, fillings or, extractions all the way, even Invisaligns, like putting on buttons on your teeth so that we can help move your teeth in orthodontic treatments. Some people, are say, I can't even have the buttons put on without sedation. We accommodate that. All the way to things like full mouth reconstructions and wisdom teeth removals. We do it all. So it starts from routine dental care all the way to complex full mouth reconstructions. We can do sedation for any of that.
Going to take another break on News Talk 580 CFRA's Experts on Call. Our guests this hour, Dr. Dania Alkhani. She's the owner of Sedation Dental Group. And we're also getting good background here from psychologist Dr. Irina Ivanova. We'll be right back on Experts on Call in just a moment.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Ask questions.
Get answers.
This is Experts on Call
On News Talk 580 CFRA.
Guests this hour, Dr. Dania Alkhani. She's the owner of Sedation Dental Group, and we're assisted along the way this hour as well by psychologist Dr. Irina Ivanova. And I want to start with Dr. Ivanova. Again, we kind of touched on what a patient should do in advance of an appointment, but let's dig into what they should do during an appointment.
Yeah. So one of the things I really recommend is, having had this conversation with your dentist before, is coming out with certain signals. So it can be a hand signal, for example, if you need a break, a tapping on your thigh. So one of the patients I worked with who had a prior history of sexual trauma and other multiple traumas, had avoided dentists for about 10 years and knew they had to go and were terrified. So we gradually started to work on talking about, that they're in control, that they can choose to stop, to speak up, because part of the experience with individuals with sexual trauma, especially, is that the robbing of the agency. So they don't feel that they can ask or have any control over what's happening. So it's really key for them to be able to say that they have full control, they can stop, they can pause, and that can really reduce that anxiety. I also train this client to focus on their breathing. So really going with the slow rhythmic breathing to calm the nervous system. The 4-7-8 breath can be really helpful. And as I said before, if you forget everything else, just focus on the long exhale. So sometimes people think, take a deep breath. That's actually counterproductive for the nervous system. The deep breath in actually activates our fight or flight response, but it's the long exhale that deactivates and puts us in the calm state. So if you forget everything else, just focus on the long exhales.
In the chair, Dr. Ivanova, I can sense that obviously being calm to begin with is certainly important, but I think a mental attitude helps as well. If you can get in the chair and say to yourself, I will be calm, I will be calm. This is okay. This is okay. That's going to go a long way in the patient's mind as well to help calm things down.
I agree. And, being really compassionate with yourself. So really, being kind and gentle with yourself is really important. So it's okay to feel anxious, telling yourself, I'm doing something that's important for my health. It's okay to feel some discomfort. I can get through this, are really helpful statements to remind yourself.
Now, what advice overall could you have for someone who knows that they need dental care, but maybe they're too anxious to actually book an appointment?
Sure. I'd say start small, call the clinic, just ask questions. Even sometimes even calling the clinic can be really difficult. That's a huge step, so maybe even browsing on the internet and looking up, content on their website. Eventually working yourself up to maybe, walking by the clinic, visiting the office without booking an appointment, asking for, meet and greet, as they offer meet and greet services at sedation clinics, so that you can get to know a little bit of the staff and get comfortable. I think a lot of people with dental anxiety benefit from the sort of the calm, validating, non-judgmental approach that the sedation clinic offers. So I think just, being able to get to know the staff and the environment, for people with, like autistic spectrum disorders, for example, they need to know what to expect. So, being able to walk through the procedure and explain the rationale can really assuage the anxiety for a lot of folks.
A lot of support would also come from family members as well. What could they do to assist in the process?
I think listening, without judgment is really important, Dave. I think validating their fears rather than dismissing them. So avoiding statements like, it's not that big of a deal, or it won't hurt that much, can really feel minimizing and actually will increase the anxiety. So our nervous system will have that backfiring effect when we're told to calm down and to relax, or when we're told, it doesn't, it's not such a big deal. So really trying to say, I understand you're scared, because, it's overwhelming to be sitting in the chair and looking at all those lights and hearing all the drill sounds and smelling the antiseptic. And so it can really go a long way to just reassure them that you get it, you're with them, and you can be there to walk through the steps with them. So maybe helping them call the clinic, going to the clinic. As Dr. Alkhani mentioned, they encourage, support people to attend the appointments. And the client I mentioned earlier who did end up going through with the treatment and getting the dental work done that they needed, did have their spouse with them. And that did prove to be a really key aspect of the support and completing the treatment. And maybe they won't need to have that the whole time. Maybe it's just initially. And, as they build their confidence and praising, your loved ones for, you did this, look at how far you've come, empowering them to feel good about themselves for having overcome this fear. Because it is a very deep and intense fear for a lot of people.
I want to go back to Dr. Alkhani for just a second here. What do you say to someone who has avoided the dentist for years because of fear?
You are not alone in this. We see patients every day who have avoided the dentist for so long out of fear, and then they've just let their oral health go, and then they feel too ashamed to address it. This is a common story we see at our clinic, but this is a really safe place for these individuals. The bravest thing a person can do in this particular situation, like Dr. Ivanova has said, is pick up the phone and call and schedule an initial meet and greet or initial consultation. They would be surprised how far they can go after this first initial consultation in turning their oral health around and thus taking control of their life back, because our mouth is not just an aesthetically pleasing area. It's an area that's required for functionality and to improve our overall health.
Dr. Alkhani, let's talk about the best ways to contact your office. We're close to the end of the hour, and I want to make sure that listeners have the information they need to make that contact to get the job done in the dentist's chair.
Yeah, absolutely. So our phone number, the best thing to do is call. Even if you have a question, you can call at 613-232-3725. You can email us at smile@sedationdentalgroup.ca. So it's smile@sedationdentalgroup.ca, or you can visit our website, like you've been saying, Dave, sedationdentalgroup.ca.
Well, I got to tell you, folks, very interesting hour. We're out of time. But Dr. Dania Alkhani, I want to thank you so much. Of course, you're the owner of Sedation Dental Group. Thanks again, Dr.